to the True Diversity Film series, Standing in Solidarity. My name is Latoya Dawson, and my pronouns are she and her, and I am a Senior Marketing Manager here at NJPAC. This evening, we are pleased to host a conversation on equal rights based on the sometimes difficult path of aging within the LGBTQ plus community. We are going to explore how a lifetime of discrimination may have an impact on the quality of life. This discussion is also informed by the Gen Silent. The link was included in your RSVP. We would like to thank the LGBTQ Employee Resource Group at NJPAC who curated this evening's discussion. This social justice series is a part of our Standing in Solidarity initiative. The purpose of this series is to bring our community together and to encourage everyone to take part in the movement to ensure civil rights for all. On our website, you can find archived prior social justice panel discussions as well as resources that will help you take action. We are also happy to have as our advisors Newark NAACP and New Jersey Institute for Social Justice, Newark Arts, and the Truth, Racial Healing, and Transformation Center at Rutgers University Newark, Director, Africana Institute at Essex County College, and Asian American Arts Alliance in ACLU, New Jersey. Now, NJPAC would like to offer a land acknowledgement. The language we are using was created with consultation and guidance from Chief Dwayne Perry on the Ramapo Lenape Munsee tribe and Oleana Whispering Dove of the Eastern Algonquin descendant. We're grateful to them for their generosity, wisdom, and labor to craft these words. NJPAC would like to offer a land acknowledgement. The language we are using are from the Lenape. We, the Lenape, original benefactors of land, once ripened and cultivated with attentiveness to the Creator and her ascendancy, express everlasting gratitude to our Creator for the traditional ancestral jurisdictions of the Munsee, Esopus, Canarsie, Capsea, Wirrapose, Siwanoy, and Wequesec, jointly known together as the Ramapo and Nanticoke Lenape tribe. Let this, our land acknowledgement, be the beginning of our return to unity. Let us be guardians of the water, the air, and the earth. The legend, the flyers, the swimmers, the crawlers, the mammal people, and the green. Let us now stand lifting our humanity, enrapturing with Earth's consciousness as guardians of harmony and kindness. We would like to take the opportunity to thank our sponsors as well, PSEG, that for close to 10 years has supported our social justice series. I would like to now introduce our moderator, Terry Wilder, Manager of the HIV Aging Policy Advocacy Portfolio at SAGE, where she implements the organization's federal and state HIV aging policy priorities. She has worked in HIV care and services since 1989, providing social services, directing education programs for clients and medical providers, and advocating for policy change. Terry is an award-winning writer and is an award-winning Terry is an award-winning writer, excuse me. She has served on the New York Governor's Task Force to End AIDS. She is currently a member of the New York State Department of Health AIDS Advisory Council. Welcome, Terry, tonight.
Thanks so much for your introduction, and thanks so much to everyone who is joining us this evening to have this great conversation. I would love to start out by having the panelists introduce themselves tonight so you can get to know them a little bit better. So I'd love to start with Jamila, if you want to come on camera and unmute yourself.
Good afternoon, folks. My name is Jamila Smith. I'm one of the project managers and trainers at Garden State Equality. A little bit about what we do. So we are an LGBTQ education and advocacy organization. And this year makes 20 years that we've been around, really pushing equality forward, both out in the political spaces, but also out in the community. So making sure that folks have the resources that they need to be thriving and amazing human beings and adults and young people, but also making sure that we're advocating for the rights of people in healthcare settings, in LGBTQ senior homes, adult facilities, and other places like that.
Great. Thank you so much. And next I'll invite Beatrice to come off mute and camera and introduce yourself.
Hi, everyone. I am Beatrice Simpkins. My pronouns are she and her, and I am the executive director of the Newark LGBT Community Center, which celebrated its 10th year in 2023. We were founded in 2013. The emphasis for the center being formed was kind of an intergenerational, interracial collection of grassroots movements and the response to the death of Sakia Gunn, who was a young Black gay woman who was killed in Newark on Broad Market Streets. And so we are here to make sure that the LGBTQ community is celebrated, that it is visible, and that it is thriving. And we offer a variety of community-led programs and services that cross different generations. And we are located at 89 Market Street in Equal Space, second floor. Thank you.
Thanks, Beatrice. And next I'd like to invite Gary to come off mute and turn on your camera.
There I am. Okay. Hi, everybody. My name is Gary Paul Wright. I am the founder and executive director of the African American Office of Gay Concerns here in Newark, New Jersey. And we've been around for 24 years, you know, as serving as a resource to the LGBTQ community, Q+I. I'm just happy to be here. Thank you for inviting me. And, you know, the AAOGC is still around. We've got some things that we're trying to clean up right now, but we are still there. And we thank everybody for their support thus far. So thank you for having me.
Thanks, Gary. And last but not least, your husband, Peter, if you would join us.
Hi, good evening, everybody. It's so wonderful to be here. I appreciate being invited. So I'm Peter Oates. My pronouns are he, him. I'm a retired nurse practitioner. I retired in March of 2022, I think. I've been in healthcare for 54 years, and 38 of those years were working in Newark as a healthcare provider. Full disclosure, I've got no previous experience on aging. Haven't been there before, but now at 72, I guess I have to get up to speed and learn a few things. So actually, I'm really looking forward to learning some stuff here, as well as trying to contribute to the conversation. So I really appreciate being here. Thank you.
Thanks so much. And, you know, I thought that it might be helpful to just share a little bit of information just to kind of set the context for our conversation tonight. Like was mentioned, I work for SAGE. We are the oldest and largest organization in the United States dedicated to serving LGBTQ plus elder community members. We were established in 1978. And our main headquarters are in New York City, but we also have services delivered in Miami, Florida. But we also do a lot of national programming. And one of the things that I wanted to share tonight was a document entitled Facts on LGBTQ plus Aging that can be found on the National Resource Center on LGBTQ plus Aging. And I can drop that link in the chat a little later, but wanted to share a little bit of information to kind of give context to our conversation tonight. It's estimated that by 2030, there will be approximately 7 million LGBTQ plus people in the United States who are 50 and older. And to put this community in historical context, the LGBTQ plus older community really came of age at a time when simply being openly LGBTQ plus could get them arrested, fired, or worse. And as such, they've experienced discrimination based on their perceived or actual sexual orientation and gender identity on many fronts. And moreover, they lived through many years in which this discrimination was condoned and even encouraged by society in the form of laws, policies, and cultural norms. LGBTQ plus older people face some unique challenges as they age, and we're going to talk about that tonight. But they're also living vibrant, full lives throughout every part of the United States and around the world. You know, as a reminder, when we think about this particular community, they were pioneers who stood up and pushed back at the Stonewall Uprising. And they were caregivers who stood by their friends and loved ones through the height of the AIDS epidemic. They are models of resilience and celebrating their identities while persevering through adversity and helping to bring about incredible change for all LGBTQ plus people over just a few short decades. I hope you had a chance to watch Gen Silent, the documentary that was referenced earlier. You know, this follows the lives of 6 LGBT seniors living in Boston area who were often forced to choose if they would hide their sexuality in order to survive in the long-term healthcare system. And it really highlights some of the important facts around LGBTQ plus aging that can be found in those the SAGE facts document I just referred to. And some of these facts include that LGBTQ plus older people are 2 times as likely to be single and live alone, 4 times less likely to have children, and 54% of LGBTQ plus older care recipients receive care from their partner, and 24% receive care from a friend. 88% of LGBTQ plus older people said they would feel more comfortable with long-term care services if they knew the staff had been specifically trained about the needs of the LGBTQ plus community. And more than 2/3 said that would make them feel much more comfortable if the staff was trained. And then finally, it's been reported that LGBTQ plus older people have received inferior, neglectful health care, or they've actually been denied health care. And research has shown that repeated experiences of discrimination can lead to long-term negative health outcomes. So I'd like to start our conversation today really looking at you, Beatrice and Jamila, to start off with. And I'm wondering if, you know, in light of what I just talked about, you know, the lack of maybe biological family, children, folks in the community that people are kind of biologically related to, thinking about families of choice to provide caregiving. And that we know that the LGBTQ plus older adults often rely on families of choice for caregiving. And I'm wondering if you can share insights into the challenges and benefits of caregiving within these chosen families compared to biological family structures. And Beatrice, I'd love to hear from you first.
Well, I think you gave a good example when you talked about Stonewall and how the community had to take care of itself during the AIDS crisis. And so you'll see the same thing happening when it comes to, you know, LGBTQ folks who are aging and unpartnered, who may not have children. You know, oftentimes, unfortunately, because you live as your authentic self, you may be estranged from your biological family. And so it's not even a question of whether your biological family is going to step in and take care of you, because oftentimes you already know that that's not going to happen. And so for many LGBTQ people, especially older adults, BIPOC people, the isolation can be quite intense. And we, of course, look to friends and, as our support system. Some of us find our support system in houses of worship. For example, being a minister in Unity Fellowship Church of Newark, which is an affirming church space, we have a responsibility to take care of each other, and that often is what happens. And so you have to create your own mutual aid network because it doesn't necessarily happen, biologically. We all think of, grandma, mom's going to take care of grandma, and the grandkids are going to take care of mom, and but that doesn't necessarily, you have sometimes people are completely severed from their families, from their parents, from their grandparents, from generations, from brothers and sisters. And so, but oftentimes it might be a niece or a nephew, because, you're their favorite auntie or you're their favorite uncle who, so, your closest generation is not who takes care of you. It's the generations beyond that. And so that's one of the challenges that we face. I fortunately have children, but even having children does not guarantee that someone's going to take care of you. You hope that that is what's going to happen. And I'm not saying anything about my kids because they're wonderful, but that's not always necessarily the case. Kids grow up, they move away, they're on the other side of the country, out of the country, living their own lives. And so, the expectation that you can rely on your children to take care of you as you age is not necessarily something that we can look forward to as a community as well. And so we seek our own caregivers, and there have a tendency to be through friendship and communities found in places like going to an LGBTQ center or going to Gary's program or engaging with Garden State Equality. And in that you develop, your own mutual aid network.
Great, thank you. Jamila, any thoughts on this topic?
I think that in terms of like building community, I think it's super important. I think that that is one of the biggest things that kind of fuels people's longevity and ability to age with like grace and at least less hardships. I think some of the challenges sometimes for caregivers, if they are like employed, is sometimes, being able to like take off of work if they have to go and support their friend or, chosen family person to be able to assist them with doctor's office visits and being able to be at the hospital or just being able to advocate in the way that they would like. Sometimes doctors are reluctant to kind of share information about a person's healthcare status if they're not technically a biological family. So there might be like a hindrance with communication, with being able to probably get information about the person's healthcare status so that they can be properly informed. But sometimes a benefit also could be that they know this person well, so they're able to advocate for their specific needs, sometimes more than they're able to do themselves. So I would say that those are some benefits and challenges, as well as like being able to get time off, like I mentioned, and recognition in the workplace, things like that.
Yeah, you're all making me think about in the documentary Gen Silent, there was a couple where one of them lived in a nursing home and the husband came every day to make sure he ate, that he was dressed, taken care of in a way, but that was respectful of who he is and his authentic self. But they had to move into a new long-term care facility because they didn't feel comfortable in the first facility. They didn't feel like they could be who they are, a married couple. They felt like they had to hide that. And then, another part of the documentary really highlighted the story of a trans woman who didn't have family. Her family had disowned her. And through her connection with a home health care agency, they worked to build a care team. And it was so beautiful to watch because these were people who had never met her before, and they, became her support system. There was footage of them having dinner with her, getting to know her. And then as her illness of cancer progressed, they were there to really be there and support her during some really challenging times. And it was the queer community that really came together to provide that support, even though they had not had a previous friendship with her. And I found that, really beautiful, and just kind of in the spirit of the LGBTQ plus community, really taking care of one another. I'd love to talk a little bit for a minute about, kind of the recognition that probably most people want to age at home, that folks are terrified for a number of reasons to age at a long-term care facility. I think, many LGBTQ plus older adults prefer aging at home, but probably face some unique challenges in accessing appropriate services and supports. And I'm wondering if we could maybe have a conversation around, if folks want to age at home, they don't want to go to a long-term care facility, how can home and community-based services really be tailored to better meet the specific needs of LGBTQ plus individuals who wish to age in their own communities? And, what are the key components of LGBTQ plus inclusive aging services in a home-based setting? And Peter, I'm going to ask you to first respond to that question.
Yes. I'm going to share a story about my own parents, actually. They're obviously not gay or LGBT, but the model of care that my father received, I think, is a model that we need to think about. And my mother died at the age of 92, very suddenly on New Year's Eve, and left my dad. And he was coping very well for about 18 months, and then he started to get sick, and he was adamant that he would never go into hospital to die. That was his thing. He didn't care what went on. He would not go into hospital. And his general practitioner, his family doctor, our family doctor, went along with that to a certain point. And I think one of the problems is that healthcare providers these days don't want to take care of people in their homes. Ship them off to the hospital and let them take care of them. And this was something that really bothered my father. And he wanted to die in the same bed that my mother died in. And he made that very clear. Anyway, my brother, God rest his soul, I mean, God love him, he lived 4 hours away, and I am obviously over here and there in England, but he used to drive, 4 hours there, 4 hours back to sort of make sure that things were in place. And we had nurses coming in twice a day. He had a care provider coming in. Then eventually he started to deteriorate, and he developed bronchial pneumonia. And one day, one of the nurses went to see him and called my brother to say that the GP is putting him in hospital. He hasn't told your father that he's putting him in hospital. He's calling the ambulance to get him there. And so my brother got in the car and drove 4 hours home to try and stop that from happening. And it was the nurses that really took the lead on that. They understood what my father needed. And so what my brother did was fire the GP, and he then got another GP who was much younger. And this guy was absolutely amazing. And he understood what my father needed, and he took care of him at home. And I flew home. My brother and I took care of him. I had night shift. My brother had day shift. And he lasted about 7 or 8 days. And when he died, the GP came to us and he started crying. He's very upset. He started crying, and he thanked us for allowing him to take care of my father at home. He said this is the first time he has ever seen someone die at home. And so that's the sort of model of care that I would like to see. Whether it can be arranged or whether we need to start thinking about those sort of home care services, to allow people to die in dignity in their own homes. So I just wanted to share that story because it's sort of a model of care that I think worked really well for everybody, including the healthcare providers. And so I think it's doable. Obviously, a lot of advocacy and determination went into making that happen, but I think it is possible.
Yeah, that's great. Thank you. And what do you think, in terms of like that particular model of care, do you think would be the most beneficial for the LGBTQ plus community?
Well, the fact that they're allowed to stay in their own environment, the homes that they've lived in and grown up in and are growing old in. As you say, people are very concerned about going to a long-term care facility or even a hospital to see the last days of their lives sort of out of their environment. And certainly it's something that I think about all the time. And Gary, Paul, and I have talked about. We've started the conversation, by the way. But I think that's the main thing is to allow them to die in dignity at home or be taken care of in their own home environment where they're used to everything.
Yeah, thank you. You're also making me think about, the LGBTQ plus older adult community is not a monolith.
Right.
We have to really think intersectionally about the community.
Yeah.
And so, LGBTQ plus older adults, are faced with discrimination around sexual orientation, gender identity, but they may have compounded discrimination based on things like race, ethnicity, or even the disability or illness or disease they may have. And so, I'm wondering if we could talk about, how can service providers and advocates address the unique challenges of the intersectionality within the community to make sure that people aren't just kind of lumped together, that there's really individual care plans based on the needs of folks. And Gary, I'd love to pivot that question to you.
Oh, gee, thanks. It's so interesting just listening to what everyone else has said. I began my advocacy work with HIV/AIDS way back in the 80s. I did some volunteer work with gay men's health crises. And I think I was some kind of, not a caregiver, but a partner, a buddy. I was a buddy. And I saw a lot of different scenarios. I had to visit people in the hospitals. I had to visit people who were at home, maybe with their partner, or maybe not. But I think one of the things we have to remember is that a lot of gay men died in that time period. So our numbers are like really, really lower than they really should be. So that's the first thing. But I think we learned during the HIV/AIDS epidemic that we are self-sufficient and that we can take care of our own community. And that's kind of been what it's been like, since then. When I started the AAOGC, it was because I didn't think that people in New Jersey, or gay men in New Jersey, gay men of color specifically, were getting their fair share of attention. So so when we started putting our people first, and then we got funding to do the transgender community, that's when kind of Newark, kind of took notice that, oh, there's some more people out here that we haven't been talking about, or we've been talking about, but we haven't been taken care of. So I think, what B and what Jamila said, is our community has been taking care of itself for a long, 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 long time. Personally, Peter and I, we thought about living in England, living our last few days in England, but we decided to stay in the United States. But we're lucky because we have each other, but we also have a great support network through our families and through our friends. And I think that's what we have to continue to do in our community, is to cultivate those friendships, because who the hell else is going to take care of us? I have family in Texas. I still have family in Texas, where I'm from, and I have family in Washington State, where my niece and her family are. And they love coming to visit their gunkles here in Newark. And I know that should something happen to either one of us, that they will step in and help us. So I don't think we're ever going to be isolated. I think we worked hard so that we couldn't be left alone and isolated. But you never know. Like you said, you never know. But we have each other right now, and I'm happy for that. And if we gotta die at home, we're gonna die at home. So, but we're not gonna die, right, Pete?
And I just want to add to that, that also within the community where we live here in South Orange, our neighbors are absolutely incredible. They take care of us. And during the COVID epidemic, they would leave little care parcels on our porch. And we know that we are loved in this community. And so we feel quite safe, and in the knowledge that there are people, our neighbors, who will pop in and sort of do things for us if we ask them to. And it's building those communities around yourself that's very important, and started at an early age. Don't leave it till the last minute. But
Right.
I feel we're very fortunate to have that community.
Yeah, and I think that goes back to what Beatrice talked about in talking about mutual aid, and kind of creating mutual aid, and having this willingness to take care of each other. Beatrice, I don't know if you wanted to share more kind of about what mutual aid is and kind of how that works in communities.
Well, yeah, and you know what, your point about starting early, Peter, is important, right? You gotta, find your friends in your aid network before you start failing, or before you getting into a really advanced age. And so, as we get older, we really have to think about that. We have to, it's almost like you have to take inventory of your own life, right? Who are my friends, and have those conversations with people. Who would take care of me if I happen to get sick, or I'm in the hospital, and who needs to know besides myself, even if I am not partnered, or I'm estranged from my family. There's usually one or two people, hopefully, that we all have, who are neighbors or close friends, or friends from high school, or that person who always stuck by you no matter what, and accepted you for who you really are. And so, it's an uncomfortable conversation to have anyway, because you're dealing with your own mortality, right? With aging also comes advancing in years, and getting closer and closer to where you will transcend to a different state of existence. And so, that in itself is something that's perplexing for us as human beings, no matter whether we're gay, straight, or whatever. And so you have to start having those conversations, when you're 45 or when you're 50, to try to scope out your aid network. What I also find too is, as you age, if you're volunteering, if you're engaged with organizations in some way in your community, food pantries, or clothing giveaways, or whatever it is that you might do as you get older, that's fulfilling for you, those touches and those connections with people will often help you find your way to developing your own mutual aid network. And just one more thing, what you were saying about elder care, my sister, who was a straight woman, who I had to care for, because some of us are caregivers already, right? We have elderly parents who are 70 and 80 and 90. My example was, because I was adopted and I came into my family when my mother was 58 years old. So my siblings were way older than me. And so I wound up taking care of my very elderly sister. She lived to be 97. And thank God, I was able to find her a practitioner who specialized in aging, and who believed in a healthcare system that had deliberately set up a program to keep elderly people in their homes. And so if more healthcare systems would do that, And if more doctors were educated on the benefits of that, then more of them would believe in it and not want to rush off and send your, parent or your grandparent off to the hospital every time something happened. And my sister was really suffering through some of her worst medical problems during COVID. So I was doubly scared for her to go to the hospital because I couldn't go with her. The last time she had went, they actually gave her the wrong medication. And so, I found a doctor who believed in my sister staying home and did everything she could to make sure that she stayed in the home. And also one unique thing we did as a family, and it's because of my own children and, educating me, we had a death doula who came into the house a couple of days a week to give me a break. Because, as a caregiver, you're also going to need a break. Because you have to take care of yourself, and you can't take care of the person that you're trying to take care of, right? And so, we need more death doulas who are trained to deal with LGBTQ people. Wouldn't that be a wonderful thing? If something like that was available to our community, thank God we had the means to be able to pay that. But that's something that, health insurance providers should look at. It's a great benefit to the family. It's like respite. It's a respite break for caregivers as well. If we could have those kind of innovations in our lives as we're aging, more preventive kind of things as opposed to reacting to, now that I've fallen trying to go to the bathroom, now you want to send me to the hospital, something that's going to prevent me from falling in the first place. And so you have to look at prevention, how's the person's home set up? Is it safe for them? We went through this whole inventory of, where there are rugs on the floor and just all kinds of different things you don't even think about, moving things to a level where people can reach it without, going too far up, or, having to climb up on a ladder, or, just the ease of living is important. And so if we could get more help and instruction on how to do those kinds of things, that would be really helpful as well.
Yeah, Beatrice, you're making me think of, I don't think a lot of people realize the benefits of home and community-based services, and that like they're offered in each state, and people don't realize that they're there for them to apply to get. So I'm assuming the majority of people on our call are from New Jersey, but it's available across the country. And you could just, I'm in Minnesota, I could look up Minnesota home and community-based services, and it'll take me to a web page that can give me information about how to apply for that, so I can get some of these services. And then, not that you were specifically talking about this, but I think people should remember the value of hospice care. When folks have a prognosis of 3 to 6 months to live, that like hospice provides some great services that can really help people out during that period of their life, and can also help the family and friends out in terms of providing those services. So, lots of kind of things to think about and not forgetting. I used to work in hospice, and one of the sad pieces to me is that I would get a referral for someone and then they would die 3 days later. And I thought, wow, wouldn't it have been amazing if the medical provider had referred them 6 months ago, so that we could have let this person get all the benefits of hospice as they could. So let me pivot just a little bit here and thinking about, I'm going to tag a little bit around mutual aid, but I want to talk about it from an intergenerational perspective. And so I'm wondering if, and this is, Beatrice, Gary, anyone can certainly jump in. How do you think the younger generation of LGBTQ plus individuals can collaborate or learn from older adults, or get together and think about mutual aid or supporting each other. And through that process, you know, there's opportunities to share wisdom and experience and kind of really preserve and honor the community.
Yeah. If I can jump in, you know, because I was dealing with HIV and AIDS and things like that, and I do want to say that the AAOGC, you know, for 24 years we've been doing this. But the young people that I've met has just been incredible. And what makes it even better is when some of these young people want to go into healthcare or something like that. But I think they all look up to us like it's pops. You know, I'm called pops, you know, in a lot of places. And that makes me feel good because I didn't have a pops when I was growing up. You know what I mean? I mean, I had a father, but I didn't have like a gay father. You know, I mean, I was an adult when I came out. But I think kids now, young people nowadays, have it just a little easier because I think that they know that there are some resources that they can turn to. And these are resources that people my age did not have. So I'm encouraged that, you know, things are only going to get better. I mean, we didn't have a Garden State equality, okay, when I was growing up. We didn't have, you know, marriage, you know, equality. You know, we had domestic partnership when Peter and I were already together for 20 years or so. So, you know, I think as we progress and as long as we don't go back into the closets, as the film referred to, I think the future is great. I think it's wonderful. You know, we have to get into politics though, because you know there's some people that are farting all over us, and they still want to continue to do that. So, you know, we cannot sit back and you know let the wave go over our heads. So we got to stay in tune and just stay in tune.
I think I'll chime in and say, I think for young people, I think my advice to them is like being curious and staying curious. I think sometimes like they feel like there is like this huge disconnect that there's nothing in common to talk about with older folks, especially like LGBTQ folks. And I'm just like, there's so much wisdom and knowledge and like opportunity for storytelling and for them to kind of get information that sometimes kind of goes above their head or they're not really thinking about. So fostering that connection, even if it's just one connection, is really, really important because they know LGBTQ senior, a senior, or their grandma, their grandpa, but really, really fostering those connections kind of hits home. And when they hear stories passed from how things have changed, like historically, and ways in which like they can have a real impact and that they're valuable is really, really important because I think sometimes they question whether their voices matter and understanding and seeing like folks that are older than them who have had a whole history of being advocates and allies and all of the things. So I think it's really important.
Yeah.
Yeah, and we're intentional about trying to engage young people all the time, right? Because I know I'm getting older, and at some point I want to be laying on the beach somewhere with an umbrella, drink in my hand, chilling, right? And so how do I get there? Because we've built these things for our generations behind us. And so we want them to stay engaged and to be able to take over in some way. And so, you know, we do Aaron Fraser, who's our program coordinator at the center, made it a point to start a community meal or restart our community meal post-COVID, which is an intergenerational meal, right? Young people, older people, all come together, sit and chit chat. You know, we can tell them about the good old days of Murphy's or when we had the fireball, or, you know, young people now express themselves maybe quite differently than maybe we did. And so, you know, I thrive off of that energy myself. And, you know, and then we're able to, you know, maybe, you know, share a little wisdom and keep young folks on track. And so, you know, as people who have, you know, agencies or delivering, you know, services to the public, you know, I know we are very intentional about making sure that we keep a safe space, not only for older adults, but for younger people. And that there's engagement between those two, because you know everybody would like a you know a pops, right? Like you said, Gary, right? As a young person, having someone around who's mature, who's been there, you may be successful to you, is really important. And our young people need that and need that guidance. And then the older person benefits from, having the engagement and being around the energy of the young people because they have energy. And so, it's really important for me, that the center be that place where intergenerational activities occur.
Mhm. The ballroom community, which is basically caters to young people, but some of the mothers and the fathers of some of these houses are kind of long in the tooth too. So I will give a shout out to my house fathers and my house mothers who are getting on up there in age. First of all, you're still here. You're not dead. You're still here, and you're still teaching your kids how to pop, dip, and spin, but also how to navigate, life. So I think that's important that we mention them as well.
Thank you. I want to talk a little bit about something that we certainly hear at Sage quite a bit, and my guess is that you all do too. Research has shown that loneliness and isolation are associated with poor physical health, and some experts have actually equated the health risk of prolonged isolation to those of smoking 15 cigarettes a day. I mean, it's that impactful. And I think people may not even think about it if somebody is sharing with them that I feel lonely and isolated and disconnected. And it makes me think about, where are there opportunities to have more socialization activities, kind of like what you were talking about, Beatrice, with the meals. Where are there opportunities for people to gather, to have events to gather? And also, I think we have to also recognize the mental health needs of people. The COVID pandemic, I think, really exacerbated some of the mental health issues that folks are experiencing. And so I'm wondering if we can, talk a little bit more about ways for people to connect and have activities to go to or to be part of, and, unpack a little bit, what initiatives or resources are out there for folks. And Jamila, I don't know if you want to kind of talk a little bit about the mental health piece here.
I mean, I think you said it best in terms of like the impacts that mental health is having on folks, especially like emotional and just the ways isolation really takes a toll. I think that the community aspect is really important. Like Beatrice mentioned in the beginning, like church groups are really important. Having organizations like Garden State Equality, but also like organizations like Out Montclair, the AOJC, other ones that are out there that really tailor and focus on senior care, and their events that are going on is really, really important. I think a big thing too is sometimes there's a bit of a disconnect in terms of knowing what's happening. Like there's so much we use technology for, and I think that this is, especially in the pandemic, has been a big issue in terms of we're all online. And sometimes that might be like a challenge or a barrier in terms of connecting with folks because there's so much happening, but also like really understanding the real like technological like disadvantages that folks are having, and even using these devices to be able to show up online and participate in events as we are still kind of in that gray space. So I think that's a big barrier in which and going back to conversations about young folks, like having young folks being able to show up and teach technology to older adults as a way to, one, bond, but also like have a real skill under their belt is really, really important, I think.
Yeah, I'm seeing somebody put in the chat, game night is every third Friday of the month at the center. Thinking about like, game night, or, sometimes organizations are able to go, like in Minnesota where I am, every Thursday night at the Walker Arts Center is free night. And I'm so excited about it because Keith Haring's exhibit is going to be in Minneapolis in
Oh.
3 weeks. And I'm like, oh, I get to go for free because they have Thursday night, free night. Like, let's get a bunch of people together and go.
Entertainment is always, I think, a hitter for folks
Yeah.
to get out. That and also like health related things, like anything that has to do with exercise, hiking, walking, any kind of movement is really, really important too in terms of taking care of mental health and being active and being a participant. So
Yeah, yeah. We had a group of gay Black men over 50 with my organization called the Greys, GREYZZZ, and that was the name that they chose. And they haven't met in a while because we're trying to restructure some stuff. But they were, I was surprised that these men were coming out and coming to a meeting at 7 o'clock at night in downtown Newark. It was like cool. And then they did potluck lunches and dinners and things like that. So we're gonna have to reinvent that or revamp that. But yeah, community is very, very important to people our age, because we get a sense of belonging, and it gives us something to do, like everybody else has said. You don't want to just stay at home and watch Judge Judy all day. Although I love Judge Judy.
Exactly. I'm wondering, before we close our evening tonight, if, folks, like Gary, Beatrice, certainly, put the websites or contact information for your organization. So if people do want to find opportunities to socialize and get together and build community together, they have that opportunity. We have about 5 minutes before we're going to kind of open it up to our audience. And I, see several questions that are already coming in. I do want to acknowledge one of the comments that is in our chat already, is that somebody put, it's tragic that LGBTQ plus folks have to struggle to live openly. Then as we age gracefully, our bodies give out. Nursing homes in New Jersey, LGBTQ still struggle with discrimination, abuse, especially with people living with HIV. Providers are still uncomfortable with gay folks here in New Jersey. And I do just want to highlight, and Jamila, feel free to jump in since your organization was really the lead on this. But in New Jersey, there was a piece of legislation that was passed just a couple of years ago called the LGBTQ plus and HIV long-term care Bill of Rights. And the purpose of that legislation is to protect the community from being discriminated against from getting into a long-term care facility. So being discriminated against because of your sexual orientation, gender identity, or your HIV status. Also protecting folks when they're in the long-term care facility. And long-term care facility doesn't just mean nursing home. It could mean assisted living. It could be rehab facility that you have to go to, maybe for rehab, maybe you had hip surgery. But then the other piece of the legislation was that it requires that these facilities have their staff trained on LGBTQ plus cultural competency, as well as around HIV. And I'm elevating this because it's law, and it's also a tool for individuals too, a self-advocacy tool that you can point out, there is this law, you cannot treat me this way, you cannot discriminate against me, because believe it or not, there are going to be facilities across the state that have no idea that this legislation was passed. And if you're joining us from another state, you can check a document that I can drop in that talks about other states that have also passed. So New York State just passed last year, Oregon, California. We've got the city of San Francisco that passed. And then if you're in Maryland, Montgomery County passed. And so sometimes we have to go the legislative route to fight against discrimination.
I just want to jump in here about sort of the training and specific trainings for facilities around LGBT, which is great. I'm a great advocate for that. But, you know, it's like the old saying, you can lead a horse to water, but you can't make them drink. And so, you know, a lot of these facilities are checking those boxes to say, oh, we have trainings every year and our staff are up to date with all the trainings and all the knowledge that they need. But at the same time, each individual staff member may have different beliefs and ideas. They may go through the training and then dismiss it. So I've seen it happen. I've seen it work in various facilities. You know, they've checked that box. We've done this, we're doing this, but the staff are still not really following what they learn. And that's a bit of a concern to me. And, you know, policies and procedures are in place, hopefully, that they can then, if something does go wrong, then the facility can say, well, this is a policy or procedure, and so you're going to be dismissed for not following those procedures. But I just want to throw that out there, that even though you're trained doesn't mean to say that you're competent and able to provide the services.
Oh, for sure.
Yeah, we often equate people getting training with everything is okay, right?
Right.
Oh, we got trained, so now everything's fine. No, it's not.
Check
No, it's not. Because that training has to be implemented and people have to be held accountable.
Mm-hmm.
Right.
And that's where the meat is at, is in the holding accountable, right? So if you're in a long-term care facility, you should be hiring lesbians, trans people, BIPOC people, all the people along the LGBTQ plus spectrum, because who could understand the experience more than someone who has lived it, right? And so we have to look at that, like the hiring practices of long-term care facilities. How many people on your staff even identify as LGBTQ plus, or feel comfortable in even coming out themselves in their workspace, to know that nothing's going to happen to them or their career trajectory is all of a sudden going to stop because now they've been identified as being gay or lesbian or trans. And so the training is great, but we also need people working in the facilities who are from our community, and folks need to hire folks who are from our community to put them, because we go to school, we get degrees, we become nurses and nurse practitioners or home health aides or, those kinds of things. And, there needs to be more intentionality about staffing long-term care facilities with people who have the lived experience.
And I think with that, that'll tie into like the ongoing education that staff will need, because if you're not an LGBTQ person, you're not sometimes thinking about the like ways in which things evolve and change and like healthcare needs change. And so how can you really be an advocate and think about these policies long term and advocate for a better education when you don't have it? So just thinking about how those two kind of play into each other.
Yeah.
And I thank God for organizations like the LGBTQ Center, Garden State Equality, Hyacinth AIDS Foundation, because they all have you guys all have these advocacy components that we at the AOGC could not do, because we're funded from the state and things like that. But but we still advocated for like, for instance, transgender people. We were the first one to get funding to actually do prevention education and services for the trans community. But thank God there are places here in New Jersey that people can go to, that they can turn to, because a lot of places don't have them.
Yeah. And, the other thing to think about with long-term care facilities is that they're often owned by a big corporation. And they don't just have one facility. They have like 7 in a town or 8 in a town. And thinking about, kind of to what Beatrice was talking about, hiring from the community and making sure that like every facility in that particular kind of conglomeration has like a liaison that can really advocate for the community. They're the holder of the knowledge around the LGBT and HIV long-term care Bill of Rights to make sure it's implemented, it's being monitored, that there's checks and balances to make sure that it's not just ink on a piece of paper. So we are at the time in our program where we are going to really open it up to questions from the audience. And we actually got some questions from folks in advance. Part of registration, you could go ahead and ask your question in advance. So I'm gonna just start with these first, and then we'll go to the ones that are put in the chat in real time here. So I'm gonna not call on anyone in particular. This can be more of a conversation. But you know, one of the first questions that came through was, what's the main thing that someone should consider as they age? You know, how do we build spaces, homes where we can get to be community for those who don't have children and might have no living family as they retire? We talked a little bit about this, but you know, I think the first part of the question is really important. What's some of the main things that you should consider as you age?
Well, you know, once again, I'm going to say how lucky I am that I found Peter Oates 33 years ago. So because I don't know, you know, where I would be right now. I mean, because he's the sane one of the two of us. And yes, you are. But
The voice of reason, maybe.
okay, well, same. Yeah, okay. But you know, I think if I were alone, I would have a lot of weird thoughts too. I mean, they talk about suicide rates, and it's, you know, it's for gay people and especially for trans people. You know, not that I'm suicidal or anything like that, because I'm also Catholic, and you know, that go to hell thing is still in my back of my mind. But you know, I thank my lucky stars that I've got Peter. So you know, for those people who don't have anybody in their lives right now, you know, you know, go outside, go to the center, go to events. I mean, there are things happening in everybody's community, and you're going to network and you're going to find people because they might be in the closet too, you know. But you know, there's code words and things that gay people do, and you know, you know how what they say, takes one to know one. It's true, you know. If your gaydar is going off, you know, you work on it. I mean, cultivate that thing, okay? That's my advice. Find companionship, find friends.
Yeah, and I think also too, there's a lot of legal stuff that you have to think about, whether you want to or not. You know, you may have a home, you may have possessions or finances, and you know, being clear about who has access to your belongings, to your bank accounts, to who is your emergency contact person if you happen to get in, you know, in a situation where you're being hospitalized or something like that. Like, you know, giving, you know, considering who might have power of attorney in your life. Those are all things that, you know, one has to think about. You know, you will have some problems when you arrive at a particular, like, let's say, you know, and somebody mentioned that, like, who gets to know about your medical status, right? If I'm not your mother or your father or your partner or your wife or your husband or however you say it, you know, then I may not be able to call up the, you know, the hospital and have somebody give me information. So having those kinds of things in place, as well as, you know, and I love what you said, Gary, you've got to keep trying to find community. That's why we try to do things where everybody can gather together, and hopefully you will find community. Giving people an opportunity to volunteer at events, you know, helps you find community. And, you know, just thinking about, you know, ways in which you can kind of, you know, plan things for yourself. And so, you know, you're kind of ahead of it instead of kind of reacting to it once it's happened.
Yeah, I think that's important. You know, when you mentioned legal, it made me think of living wills, your power of attorney, but medical power of attorney. You know, what if you are unable to speak for yourself? Who is that designated person who can speak on your behalf and actually knows your wishes and how you would want things to go with your medical care? So those things are absolutely important. And I love that you mentioned volunteering. And I'll just share something quick from my personal life. I would say that my best friends in the entire world are people who I volunteered with. So I was in ACT UP New York, not during the big heyday, but there from 2012 on until I moved. And, you know, some of my best friends to this day are people that I met through ACT UP because we were volunteering together, you know, to fight for social justice for people living with HIV. And I value those relationships because we shared the same values about how we want the world to be. So yeah, volunteering is great. Somebody is asking, years ago, I would love to go to Murphy's in Newark by myself and just dance the night away. Now as a single person, there's nowhere to go. The Loft, Better Days, and the Gallery are all closed. Any advice?
That's sounds like Beatrice's.
Yeah, we need to have pop-up parties. That's what the advice I have. Let's just find somewhere and let's just all gather there. But that is so true. I think that's one of the biggest disappointments in the city of Newark for the LGBTQ community of whatever. If you're old enough to be able to go out and socialize in a club or have a drink and dinner, you know, the fact that there's nothing here now that's just for us is to me something that the center is really seriously looking at and trying to figure out a strategy to make something else happen, because I miss it myself. I'm a Murphy's head. Okay, I was there on Thursday, Friday, Saturday, Sunday afternoon, because we had somewhere to go every single day. If it was a Monday night, you could go to Murphy's. If it was Tuesday night, you could go to Murphy's. And so now there's, you know, we have to create our own part, like, you know, that's why I love we started the film festival, because it's a whole weekend of festivities just for us.
Yeah.
You know, we got a Friday night thing going on, we got a Saturday thing going, we got a Sunday, and it feels so good to know that you've got 3 days where you can connect with your community in a festive and celebratory way. And that is so important. And so, you know, for me, there needs to be an economic strategy on how we get back the things that we lost, not only during COVID, but even prior to COVID. And why is it that we don't have an entertainment venue in the largest city in the state of New Jersey and the county seat for Essex County, and we do not have an permanent entertainment venue or a neighborhood in the city of Newark? So we have to create one.
Yes.
Who's with me?
So what I'm hearing immediately is that for the person who asked that question, Beatrice is inviting you to come to the New York LGBTQ Film Festival for the week, but apparently for the weekend. So let's look at some of the questions that came in while we were all talking. Do you think we can create a network of people from all of our organizations and neighborhoods who can become helpers for aging LGBTQ plus IA seniors in need?
Well, you know what? I think that's something that we need to work on. You know, the idea is out there now, and I think there's some of us who need to, you know, have this conversation and carry it on. It ain't gonna happen if we don't make it happen. So I saw one of the comments that said, you know, easier said than done when I talked about, you know, going out and, you know, partying or meeting people. So we got a lot of work to do. We do have a lot of work to do. I'm trying to retire myself, you know, so I could sit at home and watch TV and get fat. But but while I'm still alive and while I'm still, you know, at the AAOGC, let's any ideas would be welcome. So, you know, y'all put it out there. So let's make it happen.
Yeah, I mean, it sounds like there might be some opportunities just kind of looking at the chat and the questions that are being asked. Like, there's a real need to kind of work on this stuff together. Maybe some of the organizations can have a LGBTQ plus aging discussion group to kind of start unpacking some of these issues and really coming up with some solutions and some goals around things. You know, I'm from Georgia, and I know for years people have talked about that people want LGBTQ plus kind of aging friendly apartment high rises, you know, that are accessible, that are affordable, that people can live in an apartment building where they know that they're part of their larger community. Um, you know, in New York City through Sage, we have a couple of buildings like that. But, you know, how do we make something like that idea grow in each community, each state, each county, you know, where people want to live with community in a place that they can feel safe and that it's affordable?
And accessible. I saw one of the comments. It says,
Absolutely accessible. Yeah.
Yeah, it's like we used to have town hall meetings. We haven't had one of those in a while, so I think it might be time to have one of those so that people can come out and tell us, or share with everybody else. Yeah,
I was
okay.
gonna say shameless plug, but Garden State Equality does have an older adults advisory board. So if you are an advocate or someone who wants to just see more communal change and bring these ideas, I highly encourage you. I'm gonna drop my email in the chat, but that is something that we would love to invite for discussion because one of our big goals is really advocacy and building and also like implementation. So I'm here, I lead the conversations, but it's really you guys who kind of give me the feedback. So I'm open to anything that you see for a vision for this.
I think Garden State Equality should have a Newark office. Okay, I have some space for you if you want to come on down and
We
check
can
it
have
out.
a conversation. You need it. You need it. We need more spaces, definitely.
Yeah, okay.
Yeah, I'm seeing lots of great ideas come through the chats. I hope folks are paying attention to that. People are, you know, making suggestions for places that people can get involved. There's a choir, you know, the LGBTQ plus film festival. Here's the ticket link, all kind of stuff, all ways to get involved. And I do, Gary, love the idea for the town hall. Town halls are great to kind of listen and percolate enthusiasm and curiosity about things like this. I also see somebody has asked if there is a sage in their town, and I can certainly drop my email in the chat. We have these SAGE collab partners. So for states or areas that we don't have a actual physical location, we can partner with people and they can become part of the SAGE system. There's a little bit of a process, but if you want to email me directly, I can get you in touch with the person at SAGE that can tell you more about our SAGE collab program. So I just want to close out here and just give each of you just like a minute to just give any kind of closing thoughts on some, you know, anything that we talked about, maybe anything that we didn't get to, just to close out before we have our final kind of announcements and close out from LaToya. So Beatrice, I'm going to give you the first pass here.
Well, thank you. The first thing I'm going to say is please come to the film festival last weekend in April. But yeah, you know, one thing the center does is respond to what the community needs. And so, you know, when we engage and we see gaps in services, we try to create something where there isn't anything. And so for the center, you know, if there are older adults out there who are looking to connect to an agency that's right in Newark, that's easily accessible, We have an elevator, everything is ADA compliant. And we have a podcast group of young people that are doing podcast training on Thursdays. So there's some young people there that you can hang out with. You can come to game night. We want to hear what you have to say, and we want to hear what you need. And then we want to put our energy into that. And so we encourage you to engage with the center. And like Gary suggested, I hear some ideas percolating, and I would love to follow up those ideas after this great event tonight and put some things into action.
Thanks, Beatrice. I'm excited about your film festival, and I live in Minnesota. I may have to get on the plane. All right. So Gary, your final thoughts here.
Let's see. I wrote something down. Oh, there are things you could do right now, like Big Brothers of America. I was a Big Brother for many, many years because we tried to adopt and we couldn't. They really screwed us over. So I became a Big Brother, and I had two little brothers, and they were great. One of them unfortunately passed away, but we still have our other little brother, and he's a grown man now, and he comes to see us. I wrote that down, and then I wrote something else. Lord have mercy. Now I can't find it. Okay. So anyway, I think becoming a social justice center might be the next thing for the AAOGC. So we're gonna be working on that, and Peter and I, a lot of times we don't, we're old married couples, so we're stay at home a lot. So if it worked for things like the film festival, we we would never go out. So thank you, B, and thank you, Garden State Equality, for being part of our lives. And everybody take advantage of what's out there already. So
thank you, Gary. Jamila?
I think, I just give the plug on our Older Adults Advisory Board group. We meet monthly to bi-monthly, and that is virtual. Also, our office is in Asbury Park, but again, we meet virtually for these conversations and discussions and planning. We try to use much of our time really just focusing on events that we want to see happen, and also really just talking about community issues. Last year, we did a panel on older adults and aging, so you want to kind of keep the momentum going in terms of what the community wants to see and what you guys think needs to be at the forefront of conversation. So I plugged my email in the chat. You guys can reach out to me via email, and we can have conversations and kind of go from there.
Great. Thank you, Jamila. And Peter?
Hi. I just want to thank the sponsors and AJ Pack for putting this on, because it's really triggered a lot of things in my mind. At 72 years old, I should have been thinking about before, but I think there are resources out there. SAGE has so many resources, going onto your websites and things and looking around to see what you're actually doing in terms of advocacy and support. And we need to tap into those resources. And I certainly will be. I've learned a lot tonight. I've learned a lot preparing for this night. And I just really want to thank you all for conducting this, and maybe we should do more of this sort of stuff. And I look forward to it. And thank you for those people who joined us in the conversation. I hope you learned something from us tonight.
Thank you so much. And so I'll give the final shameless plug. So SAGE is having a 3-part webinar series starting in May about the Older Americans Act, which is a really critical piece of federal legislation for older people. And recently, a final rule came out designating the LGBTQ plus folks and people living with HIV as a population of greatest social need under the Older Americans Act. And so we decided that it might be important to kind of demystify what does the Older Americans Act mean for the HIV community, the LGBTQ plus community. So on May 2nd, we're having our Demystifying the Older Americans Act for people living with HIV, May 9th. We have Demystifying the Older Americans Act for the LGBTQ plus community. And then on our final gathering, it's when we really look at the issues from the perspective of, empowerment and from an activist perspective, how do we advance the Older Americans Act to be inclusive of our community members? So it's free. I put the registration link in the chat, and we, as of this morning, have already over 550 people registered. So do not fear that. We can have up to 1,000 people. So anyway, that's my shameless plug. We hope you'll join us for our webinar series to learn more about the Older Americans Act, the services that it provides that our community members can actually tap into. So with that, thank you so much to everyone for inviting us to have this conversation tonight. And I'm going to turn it back over to LaToya for final comments and our closeout.
Thank you. Thank you so much, Terry. And that's not the final plug, because we do have some more. So I don't think we mentioned the Newark LGBTQ Film Festival enough. So I'm just going to go ahead and just plug that a little bit more. So on the weekend of April 26th, the Newark LGBTQ Community Center, along with our community partners, will host the second annual Newark LGBTQ Film Festival. This queer film festival is first of its kind in the city of Newark and the state of New Jersey to focus on LGBTQIA+ filmmakers, directors, actors, specifically those from Newark and the surrounding areas. The festival also holds the shared goal of the center to create a safe, inclusive environment for LGBTQ community in Newark and beyond. You can get more information about this at newarklgbtqcenter.org. But I still have more. I first want to say this was an amazing discussion this evening, and I want to thank the panel. I want to thank our moderator, Terry, here, and I want to thank you, the audience. Panelists, please make sure you join us next month on May 6th for a discussion on allyship with the Black and Chinese community in Mississippi. The documentary Far East, Deep South provides a poignant portrait of a tribute to Chinese family and their experiences in the South. We also invite you to our wellness fair on Wednesday, April 17th from 11 to 2 p.m. right at NJPAC. Here you can attend a free gathering on creative health resources and exhibitions. Lastly, don't forget to get your tickets for Alvin Ailey American Dance Theater, our annual Mother's Day weekend tribute. Thank you so much to everyone who joined tonight. We hope to see you next month, and hopefully you all continue on with the conversation. We'll see you next time. Bye-bye.
Bye, y'all. Thank you.
Bye.
Bye.
Thank you.